I grew up in Ocala, Florida. I was born and raised there. After graduating high school, I went to Gainesville for my undergraduate training. I ended up staying in Gainesville for 13 years to complete my undergraduate degree, dental school, and then eventually residency, where I also was able to obtain my medical degree. My initial interest in dentistry came from my experience with my pediatric dentist, who was always so kind, and it was a great experience every time I went to go see him. I never thought it was something scary or intimidating, so I took that and I explored the career of dentistry. And although obviously I didn't go into pediatrics, I found oral and maxillofacial surgery as my main interest, and I pursued that route. We try to make patients feel as comfortable as possible from the very first time they contact us, whether they walk in to schedule an appointment or contact us via telephone. Once they get in here and we welcome them warmly, then we see them back for a consultation, and I try to explain to them exactly what's going to happen to the most detail possible, just so that they don't get surprised or anxious by getting something that's unknown to them throughout their experience here. Patients have lots of options when they come to see us, from the most minor, being local anesthesia, to the most extreme, which would be either in-office general anesthesia or even general anesthesia in the hospital setting. We understand that patients young and old, they all have different medical conditions, they all present different challenges to us, so we offer a wide range of options for them depending on their certain condition and what they need, what they feel comfortable with. Our offices have the opportunity to use CT scanners, which are commonplace in dental practices nowadays, but we take that a little bit further if we need to, meaning we can use that to evaluate pathology, fractures, trauma, or even when we're treatment planning complex implant cases, we can use that for bone grafting, implant placement. We also use the most up-to-date research and practices when it comes to all of our procedures and surgical processes, from implants to bone grafting. All the doctors here at North Florida Oral and Facial Surgery go above and beyond our minimum requirement of continuing education. When I'm not in the office, I'm usually at home hanging out with my wife and our puppy, Griffin, and I like to go to the gym, stay physically active. And on weekends during football season, I'm a big Florida Gator fan, as I went to the university for 13 years and lived in Gainesville for that long.